Hello, it's Dr. Elkins here at Legacy Health and Wellness. I wanted to take a moment to give you an update on the COVID-19 pandemic with some recommendations on how we should be handling it at this time. Louisiana's daily case numbers for COVID-19 peaked in mid to late July, and they've continued a steady decline after the mask mandate in July until they've been fairly steady as I record this on October 15th. There are a couple of important points to realize here. The first is that case numbers being low reflect the success of the measures taken to reduce the spread of the virus, not that we have reached any level of herd immunity. The second is that we're about to enter flu season, and the combination of infection with COVID-19 and the flu, whether together or back-to-back, presents a greater risk to your health than either one alone. It's estimated currently that only around 10% of people have been infected with the virus so far. That's both in the United States and around the world. And that means it still has the potential to surge anytime those measures are relaxed. So for these reasons, we continue to recommend wearing your mask around others outside your household. This is especially important in enclosed spaces such as indoors, especially crowded places, or when riding in a car. I think that the use of masks is probably the number one reason our COVID-19 case numbers are low at this time. Even though not every single person is wearing them, and those who do aren't always using them perfectly correctly as we would like, they still seem to be having a benefit for the community. Although some people may recommend for or against masks for political reasons, I recommend them for the health of our families, workplaces, and communities. I don't call it a new normal because it won't be forever. But for now, it's a helpful part of reducing the spread and protecting each other, especially the most vulnerable people who live and work among us. Masks work by catching water droplets that leave your mouth or nose while talking, coughing, or sneezing. Most masks don't catch the tiny viral particles themselves, but most of the virus we exhale is contained in water droplets that the masks are able to catch. So masks reduce but don't totally eliminate the amount of virus that people release into the air around them. People become contagious with COVID-19 up to 48 hours before their symptoms develop. So it's not unusual for people to actually spread it to others before they know they have it. I would really encourage everyone to not ignore minor symptoms such as sneezing or coughing with or without fever, since even minor symptoms like that could be the earliest symptoms of COVID-19. You may not be seriously ill, but we want to protect others from spreading that infection. If you develop any symptoms, we recommend you stay home from work and check with your healthcare provider for advice before going back to work, especially if you do run into fever. There are a few practical tips that can really help you with wearing a mask in the safest and most effective way. For cloth masks, those with several layers and more tightly woven fabrics tend to be more effective. You want to find a mask that's comfortable for you to make it easy to wear. The mask should be able to stay in place without having to adjust the position with your hands too much. If you wear a surgical mask like this one, generally the colored side should go outward, and the softer fuzzy side should be toward your face. There's a wire in the top that you can bend for the place for your nose, and then you can put the mask on like this. For those of us who have fogging when wearing a mask with glasses, it's best to try to keep as tight a space between the mask and your nose to keep air from going upward toward your glasses. If the mask often comes down while you're talking, then you may want to keep it from being below your chin. If it's below your chin, it'll come down as you talk. But just raise it to here and it won't tend to come down as you talk. Even though a mask does muffle your voice a little bit, please don't pull down your mask when you want to talk to someone, because that's exactly when you should be wearing your mask. And if you have to cough or sneeze, do it with the mask on, unless you have a Kleenex or something else to cough or sneeze into, or if you're outdoors away from others. I recommend sanitizing your hands after putting on your mask and anytime you have to touch your mask. And I also suggest avoiding handshakes. But if you do shake someone's hand, make sure to sanitize your hands immediately afterward, especially before touching your face. And one more thing, please don't forget to get your flu shot. One reason we are especially encouraging people to get their flu shots this year is to reduce the risk of having COVID-19 and the flu at the same time or back to back. which could potentially be a lot more serious than having either infection alone. And remember, the flu shot cannot cause the flu because there's no living virus in the flu shot. Although it is true that some people may feel a little down for a couple of days after getting the shot as their immune system reacts to it. We've learned that by doing these responsible behaviors, social distancing, wearing a mask, sanitizing your hands, and staying away from others when you're sick, we can all stay safer and keep going on with our lives. Thank you for doing your part to keep yourself and others safe and healthy.
Mask up, everybody!